Healthcare. Depending on your gender, the way that you are treated in healthcare will differ. Women will have less power over their own bodies, while men could be taken less seriously about the pain. Um, just like anything else I've discussed so far, gender plays an important role on the way that you are treated within the healthcare system. Um, Depending on your healthcare provider, they may choose to play into the social standards and stigmas of gender in the healthcare organization. Women and girls often face greater barriers than men and boys to accessing health information and services. These barriers include restrictions on mobility, lack of access to decision-making power, lower literacy rates, discriminatory attitudes of communities and healthcare providers, and lack of training and awareness amongst healthcare providers and health systems. Lack of training and awareness amongst healthcare providers and health systems of the specific health needs and challenges of women. This quote does come from the World Health Organization, just like the rest of the quotes that I will be using on this slide. I think the 2 points that I've underlined underneath this quote are very important to this topic. The lack of access to decision-making power. This does play a very important role in women trying to gain access to healthcare. For instance, if a man and a woman walk into an ER together, the man may be a husband, which means a healthcare provider could look to the husband instead of the woman when it comes to the treatment. And then the second one is lack of training and awareness amongst the specific health needs and challenges of women. I think this is a very important topic. Women's bodies are very, very different from a man's. I think there are very specific needs that need to be met when it comes to a woman's body in the healthcare department. Women go through much higher rates of rape and violent attacks. These things need to be taken into consideration in the healthcare field because there can be a lot of stigma behind these challenges for women. And the next quote says, women and girls face greater risk of unintended pregnancies, sexually transmitted infections, including HIV, cervical cancer, malnutrition, lower vision, respiratory infections, malnutrition, and other abuse, amongst others. Which calls into question, why are the rates for these things for women so much higher than men? Why there shouldn't be a reason for these things. Unintended pregnancies, of course, only women can get pregnant. Genetic women can get pregnant. However, sexually transmitted infections, malnutrition, um, the higher rates of malnutrition may be important when I discuss the media aspect of gender and elder abuse. Why are these things so high? Now getting into the men. For example, specific notations of masculinity may encourage boys and men to smoke, take sexual and other health risks, misuse alcohol, and not seek help or health care. Men, especially in society, are viewed as powerful creatures without any issues. For a man to admit that they are in pain and they need help from a healthcare provider might be difficult due to the stigma surrounding weakness, quote unquote, um, which may influence the way that they are treated. If a man goes into an ER saying that they barely hurt, but really they're in a lot of pain, they will be treated as if they barely are in pain. The next and final quote says, gender norms also contribute to boys and men perpetrating violence as well as being subject to violence themselves. Also coming from the World Health Organization. Boys are definitely going to be more violent typically than women. Um, Violence can include many different forms. However, physical violence is probably the most normal and high occurring rates than any other type of violence. Um, these can lead to specific healthcare risks and needs amongst men, better access to healthcare because that of the fact that they are typically more violent. However, um, an everyday man does not go to an ER every single day because they have been in a fist fight with another guy. That just doesn't happen. Um, However, when it does happen, there needs to be more talk about action in the healthcare organization.